UTI, urinary tract infection. What is UTI? Causes of UTI, risk factors of UTI, and symptoms of UTI. What is UTI? Infection in the urinary tract is called as UTI or urinary tract infection. To understand this, you should know a little bit about urinary tract. Urinary tract consists of 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. Kidney plays a very important role in excretion of metabolic waste products and formation of urine. The ureters drain urine from the kidney and deliver it to the bladder. Function of bladder is to store urine and then release during micturition. Urethra is the tube through which urine passes from the bladder to the exterior of the body. The female urethra is around 2 inches long and ends inferior to the clitoris and superior to the vaginal opening. In males, the urethra is around 8 to 10 inches long and ends at the tip of the penis. Infection in the urinary tract caused by microorganisms and most common bacteria is E. coli, derived from gastrointestinal tract. UTI is the term commonly used to describe urethritis and cystitis. Infection in the urethra called as urethritis. Infection in the bladder is called as cystitis. But infection can be in any part of the urinary tract from the kidney to urethra. Microorganisms or bacteria can travel from urethra to bladder, bladder to ureter, and ureter to the kidney, which may result in pyelonephritis, that is, infection in the kidney. Urinary tract is divided into 2 parts, upper urinary tract and lower urinary tract. Upper urinary tract consists of kidney and ureter. Lower urinary tract consists of bladder and urethra. Here you can see the urinary system where there are 2 kidneys, 2 ureter, 1 bladder and urethra. Causes of UTI. E. coli or Escherichia coli is the most common microorganism to infect urethra, but other microbes like Proteus, Pseudomonas, Streptococci, Staphylococci, and Klebsiella are also common. Chlamydia and Mycoplasma can infect the urethra and reproductive system, but not the bladder. Chlamydia and Mycoplasma infections may be sexually transmitted and require treatment of sexual partners. UTI is more common in women because in women the ascent of organism into the bladder is easier than in men. The urethra is shorter and the absence of bactericidal prostatic secretions may be relevant. Sexual intercourse may cause minor urethral trauma and transfer bacteria from the perineum into the bladder. Risk factors of UTI. Poor hygiene, using dirty toilets, multiple sexual partners or new sexual partner, using a diaphragm for birth control because it may slow urinary flow and allow bacteria to multiply. Condom use may also cause UTI because of minor vaginal trauma during intercourse. Tampons and spermicidal jelly may cause irritation of vaginal and surrounding skin, which can result in UTI. Pregnancy, menopause, nerve damage around bladder, or in spinal cord injury, patient cannot completely empty bladder, which can allow bacteria to grow. Using catheters in bedridden patients, diabetes, bowel incontinence, and any instrumentation in the bladder or urethra during surgery. Kidney stones, enlarged prostate, inappropriate use of antibiotics, interrupt natural flora of gastrointestinal tract and urinary tract. Now, symptoms of UTI. Symptoms of UTI depends upon age, gender, other associated disorders, presence of catheter, and the site of infection. Abrupt onset of frequency of micturition and urgency. Dysuria, pain in the urethra or burning sensation during micturition. Pain in lower abdomen during and after urination. Cloudy urine with an unpleasant odor. Sometimes blood in urine, which is called hematuria, which may be microscopic or visible. Fever, when infection reached it to the kidney, usually in catheterized patients. But it can be the first symptom in men. Nausea and vomiting if infection is severe. Acute pyelonephritis is a condition when infection spreads to the kidney, recognized by fever with chills, rigors, nausea, vomiting, loin pain or back pain, hypotension, guarding or rigidity may be an indication of hospitalization. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.